Good evening, everyone, and welcome, welcome, welcome. My name is Dr. Ebony Lewis, and I'm the Director of DEI Special Projects in the Vice Chancellor's Office of Diversity, Equity, and Inclusion here at UC Davis. It is our pleasure to welcome you here for our webinar focused on addressing African American youth and the effects of COVID on African American youth and how to keep your children safe as parents, guardians, and family. This webinar is part of a series, Parenting in a Pandemic, and it is co-sponsored by the Institute of Diversity, Equity, and Advancement, the IDEA Center, which is in the Office of Diversity, Equity, and Inclusion. It's also co-sponsored by Healthy Yolo Together, Healthy Davis Together, with a Public Health Project, as well as UC Davis Health Goal. The goal is to stop the spread of COVID, to keep our families safe, to keep our children safe, to keep people safe. Our goal is also to provide you with evidence-based information to counter misinformation, to ensure that vulnerable populations most impacted by COVID can make informed decisions and, again, have as much information as possible. We are here to answer your questions so that you can make choices to keep your children and your family safe and to continue to learn and thrive in school and at home. So during this time together, we will offer more, or we will be offering more webinars as information changes, but we're really pleased to be able to offer this session to this evening to complement a session we offered in the fall, and we will continue to help provide information accordingly. So at this time, it is my pleasure to introduce our first speaker, Dr. Michael Lucien, who is a pediatrician at UC Davis Medical Center. Dr. Lucien grew up in the Sacramento area and graduated from Hiram Johnson School. He completed his undergraduate degree and master's in public health at UCLA and graduated from UC Davis Medical School and UC Davis Pediatric Residency. Dr. Lucien has worked for 26 years as a general pediatrician, and we want to thank him for joining us once again to our panel and to speak with all of you this evening. So without further ado, Dr. Lucien is in your hands.
Thank you very much. And I would like to start by just saying it's really a pleasure for me to be able to share with you guys. I was part of the presentation back in November. It's going to be a little different. We wanted to share my screen and it won't let me. So somebody's going to have to, so I can bring up my presentation.
You should be able to now.
Okay, thank you. Sorry. Perfect. There it is. There we go. Oh, that's not the one. Oh, for some reason I can't find my presentation. Let me get to where I am. There we go. Okay. Perfect. Sorry for the delay there. So as opposed to the last presentation where I really focused on how the virus and the information on the background of the virus, this time I really want to talk, at least initially, about the effects of COVID and what it shows about the Black community and effects with terms of health, so you have a better understanding of why we are where we are today. And so the topic or the title is going to be Structural Racism, a Foundation for COVID-19 Disaster in the Black Communities. So just to give you a perspective, this is the latest data from yesterday. There, according to the Johns Hopkins study, there have been over 300 million cases of COVID globally, and in the US, over 60 million. And the number of deaths from COVID globally is over 5 million, and in the US, over 800,000. So we are going to talk about some of the myths and facts that are related to COVID in the Black community, the understanding of the difference between race and racism and how it plays a role in where we are as a community related to COVID, what social determinants of health are, and then because I'm a pediatrician, obviously I have to talk about pediatric issues. So I'll give you some updated information on pediatric COVID statistics, and then things that we can do and things that we would recommend that either as a community or parents or even patients do to help prevent the spread of COVID. So some of the myths and facts related to COVID. So we're going to go back to the beginning of this pandemic in this case, and you will see that the early cases back when it was first being diagnosed out of China, there was a misconception that for some reason that Black people maybe didn't get COVID like the rest of the world because there were very few cases in Africa. And then the picture to your right here is a student who was actually happened to be in China at the time of the initial cases and had done so well when so many other people were not surviving. So much so that there was actually reports that, and I'll read the top part here, Chinese doctors had confirmed that this patient remained alive because he had Black skin and that the antibodies in Blacks were 3 times stronger and more powerful and resistant than that of whites. And so this was a misconception that got out there. And with that, the people of the Black community were said, well, we don't really have to worry about COVID because it doesn't affect us the way it does other ethnic groups. And so this was a challenge because if you looked at the early results, it was shown that Blacks actually, compared to other communities, had a disproportionately greater chance of being sicker when they were exposed to COVID, and with that, a higher death rate. And these are just some examples of some of the articles that tried to counteract that initial perception that it was not something that we as a community have to worry about. And so there were, shows that people of color were more likely to be positive when they got tested early on. It was difficult for many of the people in those communities to even get tested. And then if they were positive, they were more likely to be hospitalized. This is from September of 2020, the Kaiser Family Foundation statistics. And it also showed that Black, Hispanic, and Native Americans were infected at a 4 times higher rate, had a 4 times higher rate of being hospitalized, according to the CDC data back in November of 20. And then in the pediatric world, Black and Latinx children were more likely to be hospitalized due to coronavirus and had higher rates of a complication called MIS-C, which is multi-system inflammatory syndrome of children. And I'll talk more about that later. In some scenarios, you'll see that Black people were accounting for 18% of the deaths, even though they were only about 12% of the US population. If you see in the little smaller banner, you can see some specific cities and areas where Chicago, even though the population was only 20%, it was counting for 70%. Blacks were accounting for 70% of the deaths. Similar disparity in Milwaukee and in the whole state of Michigan. And so this is, again, some graphs that are just illustrating that point again, that if you look at it, the green line at the very top has to do with the death toll per 100,000 based on ethnicity. And you can see that Blacks were at the highest level. And why is that? Well, there's some biological causes that may be in play for that. One of them is there seemed to be a link in a study that shows that vitamin D deficiency increase your mortality risk for COVID. And we know that the Black community has a higher risk of having low vitamin D levels, that obesity, which is higher in certain ethnic communities, particularly the Black. And then there was also some concern that there's actually an expression of a ACE2 receptor that if it wasn't expressed as high in the Black community or white community as Asians, that actually meant you had a greater chance, because we do know that once you get the infection, lung problems are the primary initial issue, even though later on you can have a multi-organ failure as a ultimate cause of not surviving. So what are the actual causes of this racial inequity in the COVID-19 outcomes in the Black community? And the answer is that it is not race, in other words, ethnicity, but maybe actually tied to some form of racism. And so there's a book called Between the World and Me that actually stated that race is just a child of racism and not the father. And that variability in race is not a biological construct, but is related to a social construct. And those impacts are most highly seen as a form of racism. And so these things all tie together. So you have race and prejudice, and then there's the institutional power, which can be systemic, institutional, interpersonal or internalized, and that ultimately can be demonstrated as a level of racism. So institutional racism is a normative and is sometimes legalized. And because of that, it is tied to both access to care as well as laws and rules as far as where you can live, what access you may have to healthy living environment that can therefore increase your risk if you're exposed to diseases or other situations such as COVID to having worse outcomes. And so just to get a history of where we are, we know that the Black people in the U.S. primarily came through slavery, and it was, people that were Black were not given the same treatment. They were experimentally treated by doctors just to maximize their labor, but not to provide healthy care. There was actually a point in time where eugenics was a study that was accepted by many higher institutions, including scientific presentations that really said that Black people were less attractive, less intelligent, and therefore less incapable of some of the things that the rest of the population was expected to be able to do. And that led to things such as forced sterilizations, Jim Crow laws, as well as lynching. And then research such as the Tuskegee experiment and the Henrietta Lacks use of cancer cells also played into this mistrust that the community still has towards medical science today. So why is this that these situations occur? And a large part of that can be tied to what we call social determinants of health. And that's defined as conditions in environments in which people are born, live, or learn, play, worship, and age that can affect a wide range of functioning and quality of life outcomes. And so 40% of that is tied into social and economic factors, which have to do with education, job status or employment status, family and social support, income, and then community safety. About 10% has to do with the physical environment where you actually live. And then there are health behaviors such as, is there a higher use of tobacco? Is there less appropriate diet? And part of that can be tied to the access to a healthy diet, exercise, alcohol use, others. And then access and the quality of healthcare that you do have access to plays a 20% role. So you tie all these things together, economics that may have some stability problems, you have problems with the neighborhood and the build of the environment that you're in, education, social and community context, and as well as health, and those all tie together to bring about what we would call institutionalized racisms. And so you have these social determinants of health tied into racism, therefore ultimately leading to some of the things that we see: higher infant mortality rates, infectious disease rates that are higher, and that's where we're tying because of COVID. And then, of course, once you do get infected, the ability to have access to healthcare or trust in the healthcare system may therefore increase your risk of having poor outcomes versus other ethnic groups. And some of the risks that can be shown here, again, just tying into comorbid diseases such as high blood pressure, hypertension, diabetes, heart disease, asthma, and then disabilities, as well as the access to some of the things that can prevent the spread of disease, such as the PPE inequities and masking and understanding of what really is the risk from these COVID. Then access. If you're unemployed, you may not have access to health care. And therefore, the idea of going to seek care is a balance between your economic status and the risk of what the cost may be for getting treatment. And then that some of the other ways in which many other groups may access healthcare, such as telemedicine, and having access to that technology may also be missing. I just wanted to give you an example of just one city to give you an understanding of how this early on was affecting the cases of COVID that were occurring. And so on the left is actually a map of the Chicago area and the communities that are tied to that. And you can see that ones that were higher in the Black community or Latino community are in the bluer color here or the red colors. And then you flip over to the higher cases of COVID, and you can see that those very much correlate to those same regions that we see where had the higher population of people of color versus ones that had more population that were either Asian or white. And so to tie this all together, one of the things that we do know is a big thing that helps a lot with the spread of the COVID and therefore better outcomes if you even get the infection, is vaccinations. And so therefore, Black and Indigenous people of color were not getting vaccinated at the same rate as other ethnic groups might be. And why was that? Well, some of that had to do with distrust of the medical community, as we talked about. Other may have to do with access. Even though the vaccine is free, initially there may not have been a lot of places in the communities where people live that had access to the vaccine. At UC Davis, we have now started an outreach program to try to get into those communities, because the ability to get to where the vaccines are may be limited by, again, your ability to have proper transportation, safety, and other things of that nature. So now I'm going to switch over to the pediatric things. Since I'm a pediatrician, everybody wants to talk about that. So just to give you an idea of some of the statistics. So again, this is the Kaiser Family Foundation, and it shows that, and this was as of the end of August, the American Indian and Alaskan Natives, as well as the Native Hawaiian and other Pacific Islanders, actually had, and this is pediatric, so we're talking about patients between the age of 0 and 19, and this is based on the number of cases per 10,000 in the population. And you can see that those two had the highest numbers, followed by Hispanic group, and that the Blacks and the whites actually had similar numbers. In fact, the number of cases per 10,000 was actually lower in the Black population compared to the white. But then all of a sudden, if we switch to hospitalizations, in other words, once you have the infection, your risk of actually winding up in the hospital, and suddenly you see this shift, again, tied into those differences that we were talking about. Still, those top three groups are still the highest groups, but now suddenly the Black population risk of being hospitalized is twice that of the whites. And then as we switch to deaths, you can see that the only group that has a higher deaths per million of pediatric cases is the American Indian and the Alaskan Natives. The Blacks now have superseded all the other groups, including the Hispanic group, which had previously higher risk of hospitalization. So why do we care about all this? Well, with the evolving pandemic, we are now at a point where most kids are going back to school. And because of that, we see the number of children who are being diagnosed with COVID has increased, not only recently, but it continues to increase. And the reasons for this include, as I mentioned, the reopening of schools, daycares, and also the emergence of two very significant variants, which have shown to be more contagious, meaning that it's easier for them to spread from one person to another. And those include the Delta, which not only had an increased ability to be contagious, but also seems to cause a worse outcome, and the Omicron, which may be even more ability to be contagious and shows an increased resistance to the vaccines that have been the hallmark of trying to prevent some of this spread. I'll talk a little bit more later about things you can do to help work with that. And so again, just to reiterate, COVID disproportionately affects the health of children of color, and that Black and Latinx children are more likely to be hospitalized and more likely to be diagnosed with the inflammatory syndrome that ultimately increases the risk of death in that pediatric population. So just a little more data just for you to kind of understand as to why it's so important to be vaccinated. And this is the latest data from the California Health Department. And you can see that ending in the time period ending the end of December, that people who were unvaccinated were 3.9, almost 4 times more likely to contract COVID than people who were vaccinated. And those numbers were 167 per 100,000 versus the vaccinated cases was about 12 per 100,000. And then as we went to hospitalizations, you can see that it was 10.1%, 10.1 times higher if you were unvaccinated, 20 per million versus only 2 per million in the people who were vaccinated. And if you did not only get hospitalized, the risk of not surviving your COVID infection, if you were unvaccinated, 16.6 more times likely than people who were vaccinated. And that was 5.2 per million versus 0.3. So there was a recent article, and just to kind of drive home again the point about why we are having this discussion and why it's so important for us as a community to try to protect our children. You can see that this is an article from the Guardian that came out last week, and it showed that COVID hospitalizations among U.S. children were soaring as schools were under pressure. So many people were trying to make it so that kids didn't have to wear masks in schools, even though there's clear evidence that that will actually be one of the things that help to support and reduce the risk of spreading. So on average, this article is showing there were actually almost 700 children that were being hospitalized every day in the U.S. on January 2nd, which was double the average of before. And if just UC Davis is any example, those numbers are continuing to go up because, again, of the spread of through the Omicron variant. And so why is masking so important? So this is a slide that just shows you that if you look on the left side, if the person who is infected with COVID is either not wearing a mask, wearing a cloth mask, wearing a surgical mask versus an N95 mask. And then at the top is if the person who's not infected falls in those categories. And so if neither of them are wearing a mask, within 15 minutes, you have been exposed to enough of the COVID to have an infectious dose that could result in you getting it. Versus, we go all the way down to the bottom right corner, you'll see that if both the person who is infected is wearing an N95 and the person who is not infected is wearing it, it takes about 25 hours. Now, in reality, most people are not going to wear an N95 mask, but even just wearing a surgical mask by both the infected patient and the person who is not infected means that as opposed to 15 minutes being enough time to be exposed, it takes a whole hour. And those are significant because most people, certainly in casual type of situations, may be around somebody for 15 minutes, but they are unlikely to be around somebody for an hour other than people in their household. So what's the conclusion to all this, and what can we do to help try to stem this, and how can we best help our community and the young people of our community? So what COVID pandemic has done is it's brought about the longstanding inequities in the United States to service, and that Black and Latinx and Native populations need our attention to help protect against the adverse outcomes that are based on centuries of discrimination. And we need to work on trying to create policies to help to decrease these health inequities, and that the lives and of your community and many of the people that you depend on are tied to that. And what things we can do is we have to work on public policies. We as a community have to come together, and that's why things such as this webinar are so important as a way to try to disseminate information and education. There are institutional things that we can do, so we have to try to leverage our power to try to get the health institutions and others to be more responsive. Interpersonal things, how you're talking to other people in your community, sharing with them, aiding them in any kind of way. And then also the things that you can do personally to help to strengthen your situation and your family. And I wanted to acknowledge that many of these slides, particularly the ones in terms of the format and the history of the COVID and Chicago specifically, were contributed and given to me by my daughter, who is Dr. Rebecca Fenton. She's actually a pediatrician and a fellow in adolescent medicine at Lurie Children's Hospital in Chicago. So at this point, having completed that, I would like to turn it over to Denisha Coco Bland, who will be sharing her information as a parent.
And before Denisha speaks, I missed introducing you and reading off your bio earlier, and it's important. So thank you so much, Dr. Lucien. And I'm going to pitch it into Coco as soon as I introduce her. So as Dr. Lucien said, our next speaker is show some love in the chat for Dr. Lucien if you can. I'm not sure if you can put it in the chat, but you can snap. We're snapping for you. Thank you so much. But Denisha Coco Bland is a mom. She's a poet. She's a host. She's an educator from South Sacramento. She is currently the Associate Director of Sacramento Area Youth Speaks, also known as SAYS, where she mentors young girls and youth from the inner city. She also graduated from UC Davis with her bachelor's in African American Studies and Education, and received her associate degree in Organizational Communication and Liberal Arts at Consumers River College. Her passion lies in empowering others through spoken word, writing, and laughter. And she believes spoken word is the most powerful element of healing the soul and the fuse to create change in the world. So please join me in welcoming Denisha Coco.
Hello, hello, everyone. Thanks for having me. And thank you, Ebony, for that lovely introduction. Also, thank you to UC Davis and DEI for putting this together, right? So we can have time to listen to greats like Dr. Lucien and just really talk about how the pandemic and COVID has been impacting us and our kids, right? Because it's been impacting us. And when this thing first started back in 2020, we thought that it was going to be something that was only here for a couple of weeks, maybe a couple of months, and 2 years removed, we're still here, right? We're still going through it. And I just want to start by saying parenting has been looking different, right? Living, working, and surviving during this pandemic have been hard on all of us. And as the country is at a fast pace to get back together and, running to get us all back to connected, the Black community is being left behind. Our community is being left behind as we're transitioning into this new world and this new reality and trying to figure it out. I must say for me, myself, the COVID has impacted me multiple times. I've actually got COVID myself when back in August. At the time, I was not vaccinated. And when I got COVID, y'all, I'm here to tell y'all, it was hard. It actually took me to catch COVID to actually be like, okay, I'm going to get vaccinated, right? Like, yeah, I'm Black and yeah, I got antibodies and yeah, they say, they can't kill us, but that COVID, it sure broke you down though. My son is a football player and he told me, he was like, Mom, I'm not gonna stop playing football. So y'all better figure this thing out. As y'all can see, I got the UC Davis Aggies behind me, go Aggies. They was like, my son was like, Mom, you better figure it out, right? Because I'm going to play football. And every time he was exposed, they was pulling him out of practice, 10 days out of practice, 10 days out of school. And so I actually went ahead and got him vaccinated. And it's his senior year. He did not want to miss school. He didn't want to miss football. So we went ahead and got vaccinated. And I'm gonna tell y'all, nothing happened, right? We both got the vaccinated, nothing happened to us. We were both okay, we were both fine. And actually, after we got vaccinated in November, my son and my mother and my father ended up catching COVID. And their experience during COVID was totally different than mine. They weren't as sick. They didn't have the body aches. They didn't have the fever. They didn't have it the same way I had it when I was impacted by it in August prior to getting the vaccination. Being an educator, I have the opportunity to still work in schools. I have the opportunity to keep my ears to the street. And I'm telling y'all, since I've been back in school, January the 2nd, I think we came back, or the 3rd, I've only been having 5 to 4 kids in my class. And my class is majority Black and brown students. And we are the people not showing up, right? We're not showing up to school. We're not showing up to work. If you chose not to get your kid vaccinated and they are missing school, make sure you're reaching out to those principals. Make sure you're reaching out to those schools to get your students homework, to get the information they need. Because one thing I'm noticing that this COVID and this pandemic has did is further the generational wealth gap and education gap. For the last 50, 60 years as Black people, we've been trying to bridge that gap, right? We've been trying to do the things we need to close in the generational wealth gap and the education gap. And this COVID has set us back like an almost 50 years here, just by us choosing not to be vaccinated, us not making sure our kids are getting their homework, not making sure we're protecting ourselves. And so just by you showing up to this webinar today and learning how to protect yourself, learning how to protect your family, is just a plus, right? We have to learn how to survive this thing during the pandemic. And so I just want to say, as a community, we have to protect each other. We have to be accountable for each other. We have to tap into things that help us grow as a community as we move through this. I just want to say for some of y'all, please, if you are in the Sacramento area and your school attends the Sacramento Unified School District, there's free testing sites. Tap into the Cernan Center. They're testing every day, Monday through Friday, 12:30 to 3:30. There's a big MLK event going on at the Cernan Center, and that's the school district on 47th Street. So if you need testing, Albert Einstein Elementary tests every day from from 3 to 6:30. Luther Burbank, if you have a student that actually attends Sacramento Unified School District, or you know anybody to go to Luther Burbank, they're offering testing every day after school, right? Maple Elementary is offering testing, vaccinations. They also have the Rose Family Creative Empowerment Center that's hosting a wellness fair on Martin Luther King Day, that's offering vaccinations, that's offering testing at 7,000 Franklin. I'm big with things that happen in South Sacramento because I'm big with the rows that grew from the concrete, right? And so I believe it's my duty to go out and get that soil from other places and bring it back to that concrete, right? In South Sac, they like to call us the kind of ghetto of Sacramento, right? We come from the concrete, but it's beauty there, right? That's where most of our Black and brown people live. And how do we stay protected, right? As Dr. Lucien was saying, keep your mask on. And I know for me, being at family gatherings, that is the hardest place to keep my mask on. When I'm at work, my mask is on. When I'm at the store, my mask is on. But when I get around my family, I get lax, right? And so coming back from this holiday, we got lax. We were having, Black people are big on gatherings. We gather, we have birthday parties, we do things, we gather. And it's hard for us sometimes to stop those things, but it's our duty to make sure our family is getting tested before those gatherings, our family is keeping our mask on before those gatherings, or maybe just having small gatherings, Zoom gatherings, until we can get back to the drop, right? Because right now, having 5 kids in my class, I have staff that's calling in. It's like, I understand it, but we have to learn how to stop this, right? We have to learn how to still navigate and live. So I just wanted to offer some motivation to my parents, to my people out there, to make sure that you're just up on it. Make sure you're sending your kids to school with PPE equipment. If you can, send them to school with masks, send them to school with wipes, send them to school with hand sanitizers. A lot of our schools are not sanitizing our schools, y'all. I'm telling y'all, every day before I walk in my classroom, I'm wiping it down. And every day after I leave, I'm wiping it down. I have requested for the janitor to clean our classrooms multiple times. My co-facilitator, Patrice Hill, has been at other schools and requested for people to clean up. So just make sure you're sending your kids to school with the proper equipment so they can protect themselves. Also too, for my parents, if you get met with doctors not giving you the medicine you need, pharmacies telling you they don't have the medicines you need, don't stop. Don't stop. Tell them to send your medicine to another pharmacy. Try another doctor, right? Try another urgent care, because sometimes people turn us away because they don't want to deal with it. They're tired of it. Just making sure we protect ourselves as a community, because we're accountable for our community. Nobody cares about the Black community like the Black community. And so if we're not caring for ourselves, if we're not protecting ourselves, then who's going to protect us? You know, when my mother caught COVID, her hardest thing was staying in the house. She kept on saying, I ain't sick. And I was like, Mom, you can possibly kill somebody. You have to stay in the house. So when you are sick, it's okay to stay in. There's a lot of programs out here that's offering resources. A lot of money came into this city, billions came into this city to protect us from COVID. So make sure you are tapping into them resources, because there's gatekeepers out there that's not telling us about these resources. And feel free to contact me and Patrice at SAYS if you need anything to do with the youth. We can know somebody that might know somebody that can help you out. So I just want to say, y'all, continue to protect yourself, continue to be safe. For those of us that are vaccinated, if you can, get your booster. If you choose not to get your booster, just make sure you keep the mask on. And I'll go ahead and turn it back over to Ebony. Thank y'all for having me. And as a Black community, let's make sure we protect ourselves and continue to thrive during this pandemic.
Thank you so much, Coco. Thank you. So I'm giving you some snaps for that heartfelt and passionate sharing of your experience and your journey, and also a lot of tips that are so important, very practical tips and things that everyone's dealing with on a day-to-day basis. So now at this time, we're going to transition to Q&A. We have lots of questions coming. So I'm going to start with the first question. The first question is, the data is great, but why is COVID with or without the shot affecting melanated people more? Where is the data regarding chemicals of the COVID, of COVID? So, why is it impacting people of color more? And also, where's the data and what's in COVID? What makes up COVID in terms of chemicals. So Dr. Lucien, would you like to take that question?
I wasn't mute. I was still muted. So, okay. Yeah. So, I think the tie to the melanin is not necessarily, as I was trying to share in my slides. There may be some situations, but they're not genetic. It's really more to do with the social determinants of health. So if you live in an impoverished area where there's less access to healthcare and preventive care, and you have a higher risk of, because more people of those colors are high blood pressure, diabetes, all of the things that we know increase your risk of, once you get the COVID infection, of having a worse outcome. That's the tie, and not related to whether or not you happen to be Black versus white or Latinx or something of that. So it's not a race issue, it's more of a social issue.
Thank you, Dr. Lucien. So the next question, probably for both of you, but how do parents let children know the importance of wearing masks outside the home without creating fear or stifling growth?
Yeah, so one of the things, being a pediatrician, most kids love to go to school. And so that's one of the areas that you can start with, is that, if you're wearing your mask, and you're less likely to get the infection, and therefore you're not going to have to not be able to go to school. Also, many of our kids, of course, if they get it, they may have a mild case, but they increase the risk of spreading it to elderly people, such as their grandparents. So, wearing your mask is a way for you to show love, so that you can still go around your G-Ma and your G-Pa and things of that nature, or be involved in activities that you enjoy outside of the home. And so that's one of the things I would show. And I think the slide that I showed, just to give an illustration of wearing the mask, really greatly decreases the risk of, even if you're exposed to somebody that you don't know has it, of you getting the infection. And therefore, especially for the younger kids who are young enough that they can't get their vaccine yet, that's the only way to really protect them, is by trying to decrease the spread with a mask.
Thank you. Coco, anything to add, or did that cover it for you?
Yeah, that covered it. Also, too, just make sure you're washing your hands, right? I know when my son come home, I'll be like, wash your hands, strip at the door, take everything out. No shoes move through our house. So just making sure you're washing your hands and keeping that mask on.
Okay. So the next question is, I think Black people's mistrust and doubt regarding the vaccine is very valid. But how do you suppose we approach the Black community when explaining why they should get the vaccine?
Yeah, so as I tried to show, so I think there is a validity to having a mistrust to, the greater medical community, or the medical, industrial complex, as some people call it. But the reality is, all you have to do is look at the numbers and see that when Black people get COVID, they have worse outcomes. And that was some of the statistics. And so we know that, because this virus is not going away, that the vaccine is the best way to protect it. And like Coco shared in her personal example, the people who were vaccinated may still get it, because that's the other thing. Why are so many people that got the vaccine and they still got sick? Yeah, but they're still talking about the fact that they were sick. They didn't wind up in a hospital. They didn't feel like they were going to die, or they didn't die. And so that's the other part of why the vaccine is so important, is because unless there's, there are some therapeutics that may be coming out, there's really no treatment for COVID once you get it. So the best way to not have to worry about a bad outcome from the COVID is to not get it in the first place. And then the second best way is to have the vaccine, so that even if you do get it, the outcome is less likely to be bad versus people who are unvaccinated. And everybody knows somebody who didn't survive. So that's the other thing I would say is, somebody who didn't survive this COVID, that, it wasn't young, wasn't that sick, in some cases. So the reality is, it's there, unless you just want to, not accept that fact.
Right. And I think for me, just approaching the Black community with care, it's like a toxic relationship, right? How do you trust your boyfriend again when he cheats on you? And that's kind of like Black people with America. How do we trust them again when, all this happened? But I like to tell people, you've been vaccinated before, right? You've been vaccinated to be in school, and then nothing happened then. And also, too, information and knowledge. A lot of people don't know about eradication, how to eradicate a disease, how to lock something in. And so you just have to inform the Black community as much as possible, as well as more of us that are vaccinated, telling our stories about nothing happened to the vaccination. I actually I was more sick without it than when I got it.
Thank you. And we had a related question, which I think you all just answered, which is why are we pushing for vaccinations when it's neither protecting nor slowing down the spread of COVID? I think.
Yeah. So basically, yeah, I mean, it does slow down the spread in certain scenarios. It's just not making it go away. And if you look at it, UC Davis, as an example, has seen a dramatic increase with the Omicron variant in hospitalizations, and started back on the East Coast, and now it's throughout the world. Well, it actually started in South Africa, but East Coast of the U.S. But the point is, if you look at the people who are being hospitalized, those are people who were not vaccinated. So even though the number of people who are positive, even if they're vaccinated, is going up, those people are not winding up in the hospital.
And no, it's not stopping COVID, but it's a way to stop with the effects when you get sick, right? It's a way to not get that sick. And I think that's the misconception. We're thinking we get vaccinated, we're not going to catch COVID no more. But it's actually like a medicine, right? It's helping you not to be able to experience COVID in a ways that it might affect or attack your body when you don't have vaccinations.
Right. And I use the example of cars and the safety equipment in cars. If you have all the safety equipment in the car, it doesn't necessarily keep you from getting in a car accident, but it probably increases the chances that you get to go home to your family when it's all done.
Right, right.
Thank you both for that so much. So we have another question, which is, what exactly are the ingredients in these vaccines? So if Dr. Lucien, maybe you could share a little bit of like how the vaccines are made, what goes into them. And then the follow-up question to that is, what are the adverse reactions to Black people?
Sure. So the only vaccine that is offered to pediatric age patients, and when I say that, I mean those who are under the age of 18, is the Pfizer vaccine, which that and Moderna are what we call mRNA vaccines. And so that created a lot of concern for a lot of people, because they're like, oh, you're changing my DNA and it's going to make me infertile and it's going to do this. So mRNA is not your DNA. It actually is what we call a messenger RNA. So what it does is it tells your body to help make proteins. And specifically in this situation, it's telling you to make an antibody against the protein, which sits on the outside of the coronavirus or the COVID-19 virus. And when that happens, I tell people it's very similar to if somebody gave you a picture of the person who's going to come and try to break in your house and rob you. The picture can't hurt you per se, may cause you some anxiety, and there obviously are some side effects to the vaccine. But the main part is when that person arrives at your door, you're like, I'm not going to let you in because I know why you're here. You're here to rob me. And that's the same way that the vaccine works in that situation. That even if the person gets in their house, it's not going to be able to cause havoc to the degree that they would if you didn't have it. And so that's the most common of there. There is also some that are more typical in the production of vaccines, and that's the Johnson & Johnson. But we have some pretty good evidence that because of the nature of and the way that this COVID virus is able to mutate or change, that doesn't give the same level of protection as the protection you get when you have that mRNA producing protection against the outer protein. And then I think the second question was about, the adverse side effects. So the interesting thing, and probably the most concerning adverse side effect that people have faced with the vaccine, is something called either myocarditis or pericarditis. And that's inflammation in the muscle or the sac that lines around your heart. Obviously a very scary thing. It's very rare, and it does, by all the evidence that we've seen and the research that I've followed, it not only is it rare, but the people who get it from the vaccine have very mild cases. I actually had a patient who had a mild case of it, didn't need anything special, never was sick, was able then to go on and get the rest of his vaccine series and did fine. We do know that if you get COVID, you can get those same two diseases. One, your risk of getting them in terms of the percentage of people who get COVID and get it is much higher than the percent of people who get it just from the vaccine. And the people who get it from the disease itself have much worse outcomes, either wind up in the hospital or in some cases that Miss C that I talked about, they may not survive the actual COVID infection. So other things that can occur are similar to any other vaccine you get. You might get a fever, you might feel body aches, you may even feel, fatigue. Those things seem to be short-lived. If you have a fever or any of those symptoms, we definitely would recommend taking medications like Tylenol or ibuprofen to decrease that, keep yourself well hydrated, and of course, stay home until those symptoms get better.
Thank you so much, Dr. Lucien. So the next question that we have is, what specific precautions does one need to take if sick before going to the grocery or a drugstore?
If you're sick with COVID or just sick?
I'm gonna guess if they feel sick, this could be a scenario in which maybe they've been diagnosed with COVID, or maybe they haven't been diagnosed yet, but they're not feeling well and they need to make a grocery store or drugstore run. Are there any tips on how they should manage that?
Yeah. So if you are sick, and obviously nowadays, if you're sick, you kind of almost should assume that it could be COVID until you prove it's not. The best thing you can do for everybody that you love and all the people that you are around is to not go out. Now, that's a lot easier said for some people than others, but if you have anybody that can go to the grocery store for you, that would be my recommendation. And of course, to get tested as soon as possible, because the last thing you want to do is get out there and then find out, a couple of days later when you do get tested that you had COVID, and now you've exposed, and people keep saying, well, how come this is not stopping? It's because, unfortunately, a lot of people are not adhering to the idea of isolation when they find out, or when they're sick, until they find out whether it's COVID or not. And so by the time they do find out, they've now exposed a number of other people who then expose a number of other people, and that's how these diseases spread. So the best recommendation is, if at all possible, and now we're in the era where you can order stuff and they'll bring it right to your house. So you don't really have to go out now. Anything you want will come right to your door. They'll leave it on your doorstep.
I was going to say that. I know Amazon Prime, they also take the pandemic EBT. So you can use your pandemic EBT on Amazon Fresh and get food delivered to you. Most of the drugstores are delivering now, but if you necessarily have to go out, I would say put that mask on, right? If you get an N95, put that on, put your gloves on, go straight in that store and get out that store. And also too, for us, just making sure we're wiping off our baskets again, because I understand everybody can't do the delivery thing, but there is a lot of delivery options. And if you got that pandemic EBT from your kids, they do take it on Amazon Fresh.
And a number of the delivery services are waiving their fees just because they recognize that, people have no other options.
Absolutely. Those are all really, really great tips. Thank you so much. So we have a number of questions still here, and we want to respond to your questions. So we're going to continue a little bit after 7. For those that need to sign off now, we want to thank you for being here. We will send out a post-event survey. We would like to get your feedback. We will also put the survey link in the chat momentarily as well, so folks can give us your feedback. We want to make sure we're meeting your needs and addressing your questions. So in the meantime, we are going to move forward and continue with other questions that have been provided. The next question is, does COVID affect African Americans with a family history of heart problems differently?
Yeah, so there's no evidence that based on a family history that you're at greater risk for, as I was talking about, the myocarditis or pericarditis. If there's a strong family history of heart disease, then it may actually increase your risk, if you do get COVID, of having heart problems, because genetically you may be more predisposed to getting problems with the heart. But there is no evidence that just because of a family history of heart problems, that getting the vaccine puts you at greater risk.
Thank you so much. And then the follow-up question to that is, how does COVID affect kids with asthma getting vaccinated?
Yeah, so again, because it's a lung, primarily initially a respiratory infection, it does cause you a greater risk for having pneumonia and other breathing problems. And if you have asthma, that is certainly one of the risk factors for having trouble breathing. So if you, and I would guess I put the next step, if you happen to have asthma and you get diagnosed with COVID, make sure you start aggressively trying to treat your asthma and those respiratory symptoms. And if at any point you're starting to have significant problems breathing, you should seek medical care as soon as possible.
And then Dr. Lucien, if someone has asthma, does getting vaccinated impact them? Does that have any adverse impacts?
Not adverse, it has a beneficial effect, because it decreases the risk of them getting COVID. And if they don't get COVID, they're less likely to have that COVID cause their asthma to be worse.
So I have another question. This one's directed toward Dr. Lucien and Coco. You may want to chime this one as well. The question is, Dr. Lucien, what do you think regarding the upcoming booster for children?
Yeah, so as I kind of talked about with the Omicron variant, we have found that one is much more easily spread or contagious compared to the other variants, but it also seems to not be as susceptible to the routine 2 doses, which was classically given for, the Pfizer and the Moderna vaccines, or the 1 dose of the Johnson & Johnson vaccine. And so because this is a new disease and everybody's constantly trying to figure out what direction and where it's going, they're constantly looking at data and researching an antibody protection against these. And they found that having a booster dramatically improved your protection against the Omicron variant. I think the latest statistics I saw was maybe about 1/3 of the protection was given by just having the traditional vaccine dosage. If you got a booster, that suddenly went back up to about 75% versus the initial COVID virus that came out, that variant, these vaccines were more like in the 80 and 90% range. So I think the young people, again, because they're going to be a source, because they're in school and they're interacting, and then they're around the people who may be at higher risk, should get their booster. As of right now, the booster is approved for those who are from 12 and up. And that probably soon that will be included also in the 5 through 11, unless of course you are at high risk, in other words, immune compromised, then you can actually get, it's not considered a booster, a 3rd dose of the vaccine. And the recommendation for getting that booster now is, as long as it's at least 5 months since the last time you got your 2nd dose.
Thank you. So the next question we have is, how do we keep our elders safe?
Vaccinate. No, that's true, but not all. Also, as Coco was saying, wearing masks, I think in a lot of situations, especially if they don't live in your household, because your kids are going to school or you're out, interacting with your kids who do go to school, if you go visit your elders, go ahead and wear a mask for that time period. I know it's not comfortable. Nobody likes to do it. It's not the same. You can't see their smile and all this stuff. But the last thing you want to do is potentially be the person who may have exposed somebody who ultimately, if they got COVID, has a less chance of surviving than, a young, healthy child would, or an adult who's young and healthy.
Okay, thank you so much. So the next question that we have is, does the booster shot build immunity to the new Omicron strand, or does it attack the previous strain?
Yeah, so as I was just saying, so the booster shot shows better protection against the new Omicron strand. It also would work against the previous one, but the key to the whole thing and why the boosters are being recommended is that they showed evidence that the Omicron did not have the same susceptibility to just levels of antibodies after the normal dosing compared to having a booster. So the booster is really being recommended because Omicron is the one that's taking over, and that has the best protection if you get a booster.
Thank you so much. And the follow-up question is, how is COVID related to the SARS virus?
So COVID is the disease as we describe it, the actual virus itself. And if you got a chance, you can go back and look at the presentation from back in November. I gave more details about the actual virus. It is actually what we call a SARS-CoV-2 virus, and it is what we call a novel virus. What that means is it's never been seen before. And because of that, nobody in the world really had any protection or antibodies against this. And not only was that a bad thing, but this particular, because a coronavirus, which is what the COVID stands for, is a very common virus. So it is responsible for a lot of, what we would call routine colds and stuff. It just so happens that this one variant, the SARS-2, was much more contagious and was much more likely to cause severe disease and unfortunately death. So the bottom line is COVID-19 is a disease that's caused by that SARS virus.
Okay, thank you. So our next question is, in light of the new debate on masks, what kind do you consider to offer the highest level of protection? Dr. Lucien, I know you showed that slide. I don't know if you're able to pull that up, but that is the next question. What's going to provide the highest level of protection?
Yeah, let me see if I can pull it back up. But as I'm trying to do that, there we go. Here we go. So you'll see that the mask that gives you the best protection is an N95 mask. And even if the person who has COVID is around you and wearing nothing, and you're wearing an N95, as opposed to being exposed to enough of the infectious COVID in 15 minutes, it takes 2.5 hours for you to get that same level of exposure. So that's just if you're only one protecting yourself. And of course, if you're both wearing it, now we're at that 25-hour mark. Short supply, but I would say if you can, especially with the fact that we know the Omicron variant is much more contagious, trying to wear N95 at least over the next weeks to months may make the wisest decision if you can. But wearing any kind of mask short of, I mean, cloth masks offer some benefit, but if you can do surgical or N95, you're in much better shape in terms of protection than just a cloth mask. And obviously all of them are better than nothing. I'll stop sharing.
Thank you, Dr. Lucien. So then our next question is, if you have a child who, well, let me make sure I got this right. Here. So let's say a child has COVID as of yesterday. How long should someone wait before getting vaccinated? So the question as it's presented is, a child has COVID as of yesterday. How long should someone wait before getting vaccinated?
Yeah. So there's actually a video by one of our pediatric infectious disease experts at UC Davis that is included at the end of my presentation from back in November. But just to summarize, the minimum time frame would be until you've resolved all your symptoms from the COVID. So that's a minimum time before you should even consider getting vaccinated would be 10 days. Most experts think that probably 30 days makes more sense because you do still have some antibodies that are going to be circulating in your body from the actual infection. We do know, unfortunately, that those antibodies don't seem to last nearly as long as the antibody protection that you get when you get the vaccination. So I would say minimum 10 days, more ideally probably 30 days. It may even go out beyond longer than that, but I wouldn't kind of trust that, hey, I'm still protected from my previous infection much beyond the 30-day mark.
Thank you so very much. And I want to thank everyone for joining us this evening. That was our last question of the evening. I believe Dr. Lucien has a slide he'll be pulling up just to remind people on how to find and engage trusted healthcare providers. So please be sure to take advantage of those resources. We want to thank Dr. Lucien, who has joined us both in November and again this evening and giving up his time and talent. We want to thank Coco for giving up her time, her experiences, her talent, and just the passion, speaking from the heart. And also Patrice Hill, who presented in November as our director of SES. And it's really critical that we are really reaching our communities and sharing so that we can help save lives and reduce the spread of COVID. A reminder to thank you on behalf of our presenters, on behalf of the Institute for Diversity, Equity, and Advancement, our Office of Diversity, Equity, Inclusion, Healthy Yolo Together, Healthy Davis Together, and UC Davis Health. We just want to say thank you for your time. Please take advantage of this information and share with others. The session, as you know, was recorded. We will share the link out to our participants once it's available so that you can share with others as well. So thank you all for joining us again and have a wonderful evening. Good night.
Hi, everybody. Thank you again.